So, as I told you guys before, Donald MacPherson, director of the Canadian Drug Policy Coalition, also works at the Simon Fraser University in the Centre for Applied Research in Mental Health and Addiction. The former drug czar of Vancouver for 12 years. Donald, good to have you on.
Good to be
Thanks
on.
for coming down. You're a tall guy here, so I want to make sure that you fit it within our camera range. It looks pretty good, maybe just a teeny little tiny bit. There we go. So he's not bumping his head on the top of the screen?
I'm following a tall guy too.
Yes, it's true. So, Donald, we attended, Marius, Jody, and I, the press conference you had at the coalition, and we also went to the neighborhood meeting that was there in Collingwood, which was very interesting. And so I thought I would, of course, have you talk a little bit about what the Canadian Drug Policy Coalition is, since it's a fairly new organization. But of course, you have an interesting past, and I wanted to ask you about that stuff as well. So I thought maybe why don't we just start with the Canadian Drug Policy Coalition, then we'll get into the other stuff in a bit.
Okay. The Canadian Drug Policy Coalition is a civil society organization that came into being about 9 months ago, last March, when a group of NGOs from across the country got together, and we had previously noticed that there wasn't a strong sort of civil society voice on drug policy issues. There was in Canada, whereas in other countries there are often 1, 2, 3 national organizations that are playing either a policy advocacy role, working with government or critiquing government or proposing new ideas, and connecting. The very broad substance use field is very broad.
Right, in the U.S.
It really even includes the pharmaceutical sort of world too, if you want to broaden it out: alcohol, tobacco, the currently illegal drugs.
Right.
So there's a lot of players, a lot of interests, and a lot of harm being done across the board because of our drug policies in all of those sectors, I would argue. And so we wanted to bring forward a group, a coalition, a broad coalition. We want activists, we want business, we want parents groups to be involved to try and advocate for better drug policies based on public health principles and human rights principles.
And on scientific evidence, as you guys
absolutely. And that's the other part of our mantra. We know a lot, and yet our policies don't reflect that knowledge. Like we know the criminalization of drugs does not deter use. We know it doesn't help people access health services should they develop a drug problem.
Right.
It stigmatizes them, it marginalizes them. So those are policy harms. Those have nothing really to do with the harms or potential harms of any substance they're using.
Right.
Those are harms that emanate directly from policy, and that's the kind of discussion we want to have in Canada, and I think we need to have that. How can our policies actually, excuse me, help facilitate people using substances more safely and minimizing problems that develop from substance use, and if problems do develop, how can our policies maximize the sort of connection and access to help that people often need?
Well, I wanted to ask you also about the 5-year study that you guys, I guess, just recently published here and made available, the Public Health Perspectives for Regulating Psychoactive Substances, in a second. One of the things, though, I was interested when we were at the 2 meetings was the focus on looking at all drugs, but also separating them and looking at them individually, rather than taking them all as one big thing, drugs, and lumping them all in together. And a lot of groups do that, and other activism groups kind of tend to do that as well if they're trying to appeal to a certain group, right? But when you're looking at the science, obviously there's big differences between cannabis and heroin and coffee and all these other things. So maybe talk a little bit about that.
Well, this is, you're referring to a paper called Public Health Perspectives for Regulating Psychoactive Substance Use. And that's a paper that the Health Officers Council of BC have been working on for about 5 years. And they've published several papers working up to this one. And they're a really interesting group because what they say to us is they say, forget the legal aspects, forget the illegal aspects. These are substances that people use in society, and it doesn't matter whether they're legal or illegal. Legal drugs have harms. Legal drugs have harms. We know that for sure. let's forget about that discussion. Let's look at each drug and try and develop a public health framework that acknowledges there will be use of the substance, but minimizes the potential harms of the substance. So, and that goes for legal drugs and currently illegal drugs. So let's level the playing field and regulate all substances using a health framework. And you know, so obviously we need to explore what that might look like. Obviously, some drugs would be more regulated than other drugs. And that's a debate that we have about all legal drugs. We debate. Some people think alcohol is not regulated enough. Some people think it's overregulated.
Right.
Tobacco. Some people think, you know, why are we kicking the crap out of tobacco? It's a civil liberties argument. I should be able to smoke tobacco wherever I want. Other people say no, it shouldn't be available in corner stores. It should be available in pharmacies, or you know, it should be more regulated. So we should be having that debate about every substance, and base that debate on the evidence of harm.
Well, and it was interesting in the materials you presented. There was this sort of graph that showed the curve that happens when you go from a completely illegal substance to a completely legal substance, and how the harms can be high on one side, and as you sort of get into the regulation in the middle, they come down, and then as something is left completely open, there can often be other harms associated with it, even on the legal side. Tobacco, for instance, the adding of all those chemicals that they do with no regulation and things like that.
Right, and the U curve, I think, is a useful tool, and it's not just leaving it completely open. It's leaving it completely open and allowing massive promotion.
Right.
So it's that massive promotion part that Rossmans and DeMaurier and Molsons and Labatt's are so good at, right? They're so good at promoting their drugs, and I think the public health folks have a real hard time with that.
Right. I'm glad to hear you mentioned Molson's and Labatt's in with drugs.
Yeah.
Thank you.
Yeah.
Well,
Exactly.
I mean,
Well, they are,
alcohol,
yes.
tobacco are the two most harmful drugs globally that you will find in terms of the numbers of people, the amount of harm caused.
I agree.
And most people like me probably feel, I certainly think alcohol should be regulated better. There should be warning signs on alcohol like we have on tobacco.
Here,
I like the idea that, you know, I can buy a bottle of wine without severe restrictions. But in the old days, and John Carsley mentioned this anecdote, in the old days, and I remember going into a liquor store with my dad, and he had to look at products on a shelf, look at a menu, write down what he wanted, hand the paper to a guy. The guy
Was that
disappeared.
in Ontario?
It was Ontario.
I know
Brother.
the system. I know the system.
Yeah, so that guy disappeared behind the counter, and he
Yeah.
came out, and there was a bottle in a brown paper
In a
bag.
brown bag.
And
Yeah.
my dad had paid for it, and I said, well, that's actually a pretty cool model, probably not for alcohol now, but maybe for other drugs. That's a model we could.
Well, and for
experiment with.
tobacco, it's very similar here in British Columbia. With it's all hidden away. They have,
That's right.
you know, behind the screens and that kind of stuff.
But it's available in every bloody corner store.
Yes.
So tobacco is an interesting example because we have reduced tobacco use massively in the last 40 or 50 years. I mean, 40 years ago, we'd all be smoking. We'd be smoking
Right now.
On the
Yeah.
bus?
On
Yeah.
CBC, people were
Yeah.
smoking. On the bus,
Oh,
on
sure.
planes.
Yeah.
So
Neuro.
we've reduced tobacco use and consumption without criminalizing it, without really making it that much less accessible, because it's accessible down the street. You go across the street, you can buy a pack of cigarettes. We've taxed it, it's more expensive, but what we've really done is regulate it. The packaging, the messaging, and where you can smoke it, how old you have to be to buy it, and all that stuff. We've regulated the heck out of tobacco.
Yeah.
And I think it's had a good impact on its use. Now,
Right.
we obviously wouldn't do that with some other drugs, right?
Right.
Or we might.
Right.
Those are
Well, you
the-
wouldn't
that's
need
a
to do that with
discussion-
coffee, for instance. I mean, you
No.
would.
But, you know, I'm sure we all know people who drink too much coffee.
Oh,
Say,
exactly.
look, you got to cut. It's not good for your liver if you drink 40 cups of coffee a day. You know.
Right.
So all of these drugs need to be talked about within the context of their harms and the
That's right.
context of their use.
Rather than just painting everything with this broad brush that says drugs.
Yeah.
You know, of course, and tobacco and alcohol have somehow always fallen out of that frame. So it's a fresh perspective for sure. So can we talk more about the study? like get a little bit more into detail about some of the findings?
Yes, I don't want to speak for the health officers. It's not our study.
Right.
We were partnering. We were launching our organization, and we were helping them release their paper.
Right.
So I can't speak to some of the technical stuff. I'm not a physician. They are all public health physicians who this paper has been through.
Right.
So I'm happy to talk about the paper.
Well, how does then? So you guys were releasing this study. Where do we move forward now to? So how do we? You were talking about the exploration process and really having this sort of debate. How does that work? I know your community meeting was one of those sort of things.
Yeah, well, for the Canadian Drug Policy Coalition, we want to support and promote a national dialogue on drug policy. And that includes, and I do have to say, we're not just about talking about regulation of drugs. We're talking about harm reduction. We're talking about incarceration, human rights. The regulation of drugs piece is a very important topic that hasn't really, it always falls off the table because it's too contentious.
Right.
People get positional, and it's hard to get people to really talk about it, and no one knows what it could look like if we use a different regulatory system. So